Next is Panatyayapratishedha व्याख्यास्यामः यथोवाच भगवान् धन्वन्तरिः मध्यम उष्णं तथा तीक्ष्णं सूक्ष्मं विशदमेव च रूक्षम् आशुकरं चैव व्यवहायित विकासश्च. The properties of alcoholic beverages madhya is ushnavirya, तीक्ष्ण guna, sukshma, vishada and ruksha also. Ashukaram, it produces effect quickly. And vyavahik औष्ण्यात् शीतोपचारं प्रत्यक्षण्यात् हन्ति मनोगतिं विशति अवयवान् सूक्ष्मात् वैशत्यात् कफशुक्रनत् मार्तं कोपयेत् रौक्ष्यात् आशुत्वात् च आशुकर्मकृत् हर्षदं च वैवाहिकत्वात् विकासित्वात् विसर्पति. The functionality of the alcoholic beverages is because of the Ushna guna, it requires Shitopachara. It has to be neutralized with the cold substances. And because of the Tikshna guna, it affects the psychological status. The movement or manogati is the mental status will be affected by because of the Tikshna guna. And because of the Sukshma guna and Vishada guna, it enters into every organ of the body and affects the function of Kapha and Shukra. Affects the metabolic functions, anabolic functions, the genetic organs functions will be affected. Then it produces Bhata Prakopa due to the Ruksha guna, and due to Ashu guna, it produces the effects immediately within a short period. It produces a feeling of well-being, Harshalam, that's a feeling of well-being or some pleasure-like sensation. Because of the Vyavahik guna and because of the Vikasi guna, it spreads throughout the body. Tadamlam rasataha proktam laghu rochana deepanam kechit lavanavarjanam rasanatra adishantihi. It's a amla rasa and rochana, it produces a appreciation of the taste, and deepana guna also is there. And so according to some, it has all the other rasas other than that of the lavana. स्निग्धैः तद् अन्नैः मांसैश्च भक्ष्यैश्च सह सेवितं भवेत् आयुप्रकाशाय बलाय उपचयाय च. Controlled consumption of the alcohol preparations along with the snigdha ahara or mamsa or any other food which is nourishing, it can help in development of the body as well as strengthen the body. But काम्यता मनसः तुष्टि धैर्यं तेजो अतिविक्रमः विजिवत् सेवमाने तु मध्ये सन्निहिता गुणाः. With controlled consumption of the alcohol, you may have a pleasant mind, and it enhances the courage, and it enhances your physical strength also, if it is controlled correctly or consumed properly with all that protocols. Tadeva annam anannam ajnana sevyamanam amatraya kayagnina hi agnisamam sametya kurute malam. If it is consumed without food and without the control over that, it can affect the body at something like the fire, which can burn the whole body and produces the mada or intoxication would occur. Madena karananam tu bhavanye anyatve bhava anyatve krute sati nigudamapi bhavam som prakashi kurute avashaha. Because of the intoxication, and as the sensory organs would not be functioning properly, and they are functioning in an abnormal manner. Sensory organs will be functioning in an abnormal manner. The initial stages of the mother intoxication, the person tends to reveal whatever he would otherwise like to hide. The hidden facts of the life may be revealed at the initial stages of the intoxication. And the mother or the intoxication is categorized into three stages. Three avasthascha madhajneha purvo madhyo atha paschimah. Purvavastha, madhyavastha and paschimavastha. Purve virya rati priti harsha bhashyadi vardhanam. In the purvavastha, in the initial stages of the intoxication, the person may have a feeling of boldness, and he may have some more enhanced sexual activity. His psychologically, he may feel pleasant as well. There could be pleasant speech, pleasant feelings in the body. That's the initial stage. In the next stage, madhya stage, pralapo madhye moha yukta ayukta kriya saraha. In the second stage, the patient would have irrelevant speech and confusion, and he will not have that relevance of the talk. Ayukta yukta kriya. He will not be able to make out which is the right thing and which is the wrong thing to be done at that moment. In the Tritiya Avastha, the Paschima Avastha, Visamyah Paschimeshete, Nasta Karma Kriya Gunaha. He becomes somewhat semi-conscious and he will not be able to do any functions and then lie down as such. Shlaishmikan Alpapittamsha Stigdhan Natropasevinah Panam Badate Atyartam Iparitam Subhadate. Sensitivity to alcoholic beverages would be varying from person to person. A Kapha Prakriti person and with the less Pitta constitution and those who consume Snigdha Ahara and who consume the alcohol in a proper controlled manner, they would not have the effects of the that bad effects of the alcohol may not be seen. Whereas nirbhaktam ekantata eva madhyam nishevyamaanam manujena nityam utpadayet kastataman vikaran apadayetya sharira bhedam. The person who consumes alcohol without food and when sitting alone, not in the social situations, such a condition would be producing different diseases and harm the body. Krudhena, Bhitena, Vipasitena, Shokabhitaptena, Bhukshitena, Vyayama Bara Adva Parikshatena, Vegavarodha Abhyatena Chapi, Atyamla Bhaksha Avata Todarena, Bhakshavatata Udarena, Sa Adirna Bhuktena Tata Avalena, Ushnapitaptena Jasevimanam, Karoti Madhyam Vidhan Vikarana. The Madhya alcohol beverages can produce the diseases according to the condition of the body and the surroundings. And the person who is having anger or who is having fear, who is thirsty, and those who are very sorrow or who is hungry, who has done a rigorous exercise and immediately after the exercise consumes alcohol, or who suppresses the natural urges of the body, or who has consumed any sour food and then the food is still in the stomach, in such condition he consumes alcohol, or Ajirna Bhuktena, those who have not digested the food earlier, and or those who are very weak, or who is in a very warm environment, then the alcohol beverages produce more complications. That's about what Sushruta has mentioned about the alcohol. The fact is, consumption of alcohol was a social practice even at that time, but it had to be regulated. Complications produced with alcohol and uncontrolled consumption of alcohol was registered at that time. Now, in the present day situation, alcoholism, consumption of alcohol, is a very serious problem throughout the world, and the WHO has considered this as one of the major health concerns, and a lot of awareness programs and global programs to reduce the complications of alcoholism are planned and executed by the WHO. And the key facts of that alcohol prevention program by the WHO, I just copied that as such, is the harmful use of alcohol is a causal factor in more than 200 diseases and injury conditions. More than 200 diseases could be produced due to consumption of the alcohol as such. Worldwide, 3 million deaths every year result from harmful use of the alcohol, and this represents 5.3% of all deaths. Overall, 5.1% of the global burden of disease and injury is attributed to alcohol as measured in disability adjusted life years. The statistical representation of the complications of the diseases as studied by the WHO, 5.1% of the global burden is due to alcohol. And beyond health consequences, the harmful use of alcohol brings significant social and economic losses to individuals and society at large. Alcohol consumption causes death and disability relatively early in life, and in people aged 20 to 39 years, approximately 13.5% of the total deaths are attributed to alcohol. There is a causal relationship between harmful use of alcohol and a range of mental and behavioral disorders, other non-communicable conditions and injuries. So, alcoholism is one of the major issues to be concerned from the health point of view, and WHO has suggested many recommendations throughout the globe, for every country, to have some policy matters related to the alcohol, where the alcohol consumption had to be controlled and reduced. And as per the 2018 report of WHO, India's, for specific about the India's per capita consumption of alcohol is 5.7 liters per year. This is about 2018 data, 5 years back data. Present situation is something different, which is lower than the world average of 15.1 liters. So, in 2018, the alcohol consumption was less than the world average. However, the total consumption of alcohol by drinkers is 14.6 liters per year. The average consumption of an alcoholic person who is addicted to alcohol is almost same as that of the average of the world as such. But the other way, there is another damaging issue. Alcohol consumption in India has been steadily increasing from 1.6 liters in 2003 to 2005 to 2.2 liters in 2010 and 5.5 liters in 2016 to 2018, and in 2020 alcohol consumption in India was about 5 billion liters, and it is estimated to reach 6.21 billion liters by 2024. These are the data, and very terrifying data, and the trend of alcohol consumption is increasing throughout, and more with the so-called educated high society people, and that's one of the issue of concern. And it's also true that the alcohol consumption is increasing among the medical personnel also. Now, the other effects of the alcohol, worldwide alcohol is responsible for a percentage of number of conditions as follows, according to some references there. Out of the total cirrhosis reported throughout the world, 32% are due to alcohol. Out of the motor vehicle accidents occurring throughout the world, 20% are due to alcohol. Out of the total mouth and oropharyngeal cancers, 19% are attributable to alcohol. Esophageal cancers, 29% of the total esophageal cancers. Liver cancer, 25% of the liver cancer. 7% of the breast cancers are attributed to alcohol consumption. And homicide, murder issues, 24% of the total murders, the alcohol could be one of the triggering causes. 11% of the suicide cases, 10% of hemorrhagic stroke. So the fact is, if you can avoid, if the alcohol is controlled and avoided, alcohol consumption is avoided, and the complications of the alcohol consumption are avoided, the total disease burden of these diseases could be reduced significantly, and that's also one of the important facts which we have to know. And India's alcohol atlas, the trend of consumption of the alcohol among the male and the female in India, southern India in our area is also a very high consuming area, and this social awareness has to be made out with or has to be publicized, and it's one of our responsibility. Now anyway, that's one fact about the alcoholism as mentioned in Sushruta as well as in the current situation. Panatyayam paramadam panajirnam athapiva panavibhramam ugram jatesha muksham lakshanam. The complications due to the alcohol consumptions are categorized into four categories by Sushruta: Panatyaya, Paramada, Pana Ajirna and Panavibhrama. And their features are Stambha, Angamarda, Hridayagraha, Todakampaha, Panatyaye, Anilakrite, Shirasorjashta, Sweda, Pralapa, Mukashoshana, Daha Murchaha, Pittatmake, Vadan, Lochana, Pitata, Shleshmatmake, Vamathu, Shita, Kapha, Praseka, Savatmake, Bhavati, Sabovikara, Sampata. Panatyaya is acute alcoholism, where the person consumes a large amount of alcohol and then the complications have occurred within a short period. That the features would be according to the dosha. Vataja alcoholism would be producing reduced movement of the body, pain throughout the body, or compression in the chest, tremors in the body, or headache. These are the complications of Vataja Panatyaya. Whereas if it is a Pittaja variety, if a Pittaja type of the alcohol is consumed and produces a Pitta Prakopa, it produces excess of sweating and irrelevant talk, dryness of the mouth, burning sensation, impaired consciousness, or yellowish discoloration of the body. Kaphaja variety would be producing vomiting, maybe salivation, and in Tridoshaja variety there could be all the symptoms. And in the current medical practice, acute alcoholism symptoms are listed in such a way that all these symptoms are mentioned, but they are not categorized into Vataja, Pittaja, Kaphaja. Whereas from Ayurvedic point of view, that dosha predominance is mentioned, which is somewhat seeming to be more methodical and more scientific. Ushpanam Angagurutam Virasanatvam Shleshmadikatvam Aruchim Malamutra Sangam Lingam Parasya Madasya Vadantirajna Trishnam Mujam Shirasi Sandishu Chapi Bedam. Paramada is the next stage where, or another of the complication, where the patient may have a heat, hot, feeling of heatness throughout the body, and angagurta, that's heaviness of the body, virasanantam, anorexia, and aruchi, constipation could be occurring. This is usually what we see in case of what we call as the post-drink effects, like the person who has consumed alcohol, the next day morning he would have that kind of a feeling. So paramada is it's not alcohol withdrawal effect, but maybe the long-term consequences of the alcohol, where the alcohol content in the body is reduced, and metabolic effects of the alcohol. Now, one of the important metabolic effect of the alcohol is it shifts the metabolism of glucose into other, and the metabolic products of the alcohol could remain in the body, and these will produce the effect, hangover effect, which we call as the hangover effect, and that's the paramada. आध्मानम उद्गीर्णम अम्लरसो विदाहो अजीर्णस्य पानजनितस्य वदन्तिलिङ्गं ज्ञेयानि तत्र विषजा सुविनिष्टानि पित्तप्रकोपजनितानि च कारणानि. Panajirna is acute consumption of heavy amount of the alcohol produces distension of the abdomen, and there could be sore irritations or even vomiting could occur, and all the pitta lakshana would occur. That's again due to consumption of a neat alcohol, or alcohol without diluting and consumed in excess. Now, in the presented situation, about the alcohol effects as such, which is in the particularly acute alcohol consumption, when the alcohol concentration in the body is around 0.0 to 0.03, the person would have a slowed reactions. There will be the inhibitions will be lesser. Patient, he will be more alert, more active, and lightheadedness will be feel. And the concentration is between 0.303 to 0.06. There will be a feeling of warmth, and the inhibition will be lost, and there will be euphoria, feeling of well-being. Concentration between 0.06 to 0.10, the speech may be slurred, there could be judgment may be impaired, and there could be the balancing will be lowered. Now, this limit up to 0.06 levels is considered as a legal alcohol limit, blood alcohol concentration in USA. In India, still there is no such a condition like a legal limit as such. And from the legal point of view, there are many issues about the alcohol consumption. If the alcohol concentration increases to 0.10 to 0.20 alcohol concentration in the body, it results in loss of coordination, impaired motor skills, exaggerated behavior, and even nausea could occur. And if the concentration is between 0.2 to 0.30, patient needs help in standing, and he may have even numb to the pain. He will not have a sensation of pain, and impaired reflexes occur, and he may have blackout and a feeling of unconsciousness. And when the concentration is 0.3 to 0.4, then there would be difficulty in staying awake. He will fall asleep, and wherever it is, on the roadside or in the gutter, he will lie down, and the heart rate would be lowered, breathing also would be lowered, body temperature tends to be reduced. Then when the concentration is 0.4 to 0.5, it becomes coma may occur. Nerve centers controlling heart and operation would be heart and the respiration would be functioning properly, and even there could be apnea. And of course, if the concentration was at 0.50, there would be certain death. That's the effect of the alcohol. Now, the same issue, acute alcoholism and blood alcohol concentration, which I have mentioned in the absolute concentration, when it comes to the question of milligram per dl, the same issue in the initial, when it is the blood alcohol concentration less than 50 milligram, it will be having that initial stages of the mada, then the madhyama mada and the paschima mada. When it becomes at that level where the patient becomes severe, the condition becomes severe, then the patient may become unconscious, and the patients are brought often at that stage. The treatment in that condition, now we see such acute alcohol intoxication patients quite frequently, and the patient tends to become unconscious, and one of the important clinical evidences in such condition would be hypoglycemia. The blood sugar level will be lesser. So when the patient is brought to you in that condition, unconscious condition, maybe at that comatose uncontrolled conditions, the protocol of the treatment now is the first thing is you have to ensure that the patient's vital functions are maintained. So airway assessment has to be done. Most of the times there could be aspiration due to the saliva or omitted alcohol, that has to be cleared, and the respiration has to be maintained, and mechanical, if necessary, if a patient is in apneic state, mechanical ventilation may be necessary. The intravenous access has to be done, and the most important thing would be to correct the hypoglycemia, high amount of glucose with the magnesium and folate. So what we generally do is administer glucose, 10% glucose with multivitamins, and then if necessary the electrolytes also are given. That is the essential life-saving treatment. Once the patient becomes alert or conscious, my prescription would be Smithsagarasa Arogyadini Kumaryasa. With that the patient may recover. In acute alcoholism, the treatment would be initially life care, and then after the patient has become viable, IV fluids, particularly dextrose, so that the blood sugar level is maintained optimally. Once the blood glucose level comes to the optimal level, patient becomes conscious, and then we can give the medicine. Contemporary medicine, the patient may have to be given the sedation with the droperidol or haloperidol, or the ethanol elimination methodoxin also is suggested, which generally not necessary. In majority of patients whom we treat, it's not necessary, and we can manage with the Smithsagar Arogyadini Kumaryasa. But the other fact, like if a patient is unconscious, reviving the patient and then IV fluids are absolutely necessary. Now, chronic alcoholism is another issue. That's the paramada. Now, in that condition, to confirm whether the person is an alcoholic or not, to name it, now there are some standard questionnaires. The standard questionnaires to confirm alcohol screening, there are two: cage questionnaire and audit questionnaires. Now, cage questionnaire is a simple direct question where you assess whether the patient has a concern about the problem or not. So the usual question asked is, have you felt that you should cut down on your drinking? And if the patient has attempted or felt that but still consume alcohol, that means he has become an addict and he can be named as an alcoholic. Or have you ever become annoyed by the criticism of your drinking? Somebody criticizing his alcoholism, but he is affected, but he still is not able to stop alcohol. Then is another sign that he has become alcoholic or alcoholic dependent. So acute alcoholism is something different. Alcoholic dependency or chronic alcoholism is something different. Then have you ever felt guilty about your drinking? Or have you ever had a morning eye opener to get rid of the hangover? Now, these are the important questions. If the answer for these is yes, but still the patient consumes alcohol, then that is considered to be a alcohol dependency, and the patient has to be treated on the line of chronic alcoholism, not that of the acute alcoholism. Then the usual standard, now these things are now standardized. When we consider a person as a excess of alcohol consumption, now provided now all these data are in such society where a certain amount of alcohol consumption is considered as a normal, but better is not to have the alcohol at all. Now what is considered as a standard is one standard drink is 12 ounces of beer, or 5 ounces of wine, or 15 ounces of any other these broad liquors, like depending on the alcohol concentration. And risk levels, 14 drinks per week for a men, or 4 drinks on any day, single day. For women, 7 drinks per week or more than 3 drinks per day. Or at the age of 65 or over, 7 drinks per week or 3 drinks on any day is considered to be an excess in the Western culture, where alcohol consumption is considered to be a regular social behavior. I would not recommend this. I am not suggesting that anything below is healthy. It's not that way. Better is not to avoid it at all. Better is to avoid it all. Now the other questionnaire, the audit questionnaire, is alcohol use disorder identification test. That's AUIDIT audit questionnaire, where the standard questions are there, and accordingly the scores could be given. and in that 1 to 4 scores are 0 to 4 scores are given, and at the end you will have the total score, and hence alcoholism or alcohol dependency can be assessed. Questions are simple. How often do you have a drinking? How often do you have a drinking, obtaining alcohol by purchasing alcohol on your own? Now, of course, these questionnaires are not absolutely necessary in Indian context, but I am just suggesting these simply because these are now considered as a universal standards. So those who are interested, they may go through these questionnaires, and if necessary, they may be used as such. Now, once the patient has a chronic alcoholism or chronic alcoholic becomes alcoholic, the clinical signs are the patient may have gynecomastia, or the patient may have spider angiometer, that's the vascular collagen tissue breakdown and reddish spots over the body. Contractures of tendons can occur, dependent contractures, very commonly in the hand, the palmar tendons, atrophy of the testicles, enlarged or shrunken liver, or enlarged spleen. These are considered as the clinical signs of chronic alcoholism, along with the behavioral changes, neuropathy, and so on. And again, alcoholism could be categorized into mild, moderate, and severe. This is as per the usual modes of diagnosis, usual standards of diagnosis. When there are 2 or 3 symptoms of these listed symptoms, it is considered as mild. When the listed symptoms, more than 4 or 5 symptoms are there, then it's moderate. More than 6 symptoms are considered as a very high. Now, as far as the treatment of alcoholism, de-addiction, the most important part of the de-addiction is a self-assessment. Person has to decide like he has to stop the alcohol. To have that, the one of the important and very useful technique which has become now evolved and then has become very prominent is Alcoholic Anonymous, where a person discusses the issue with another person who has an alcoholic and who has now withdrawn from the alcohol. So such Alcoholic Anonymous is now a group, a very organized group, and their website is there, and those who are addicted to alcohol can take the help, and it's now proved beyond doubt that discussion with the other alcoholic de-addicts who have come out of the alcoholism can help much better than any of the protocol of the treatment in chronic alcoholism. Now, as far as the medical treatment of the chronic alcoholism is concerned, and alcoholic de-addiction is concerned, at one stage, administration of the pharmacological drugs was considered as quite useful. Now at present, disulfiram or antabuse is not considered as a first priority. The priority is to have a maybe counseling, and better than any medical counseling among the anonymous alcoholics is considered to be a better tool, and that is now becoming very popular. As I told you, I show you, this is the website, and the first page of the website, you have that what is Alcoholic Anonymous definition also, and those who can contact the alcoholic can contact the Alcoholic Anonymous nearby. And the other drugs is antabuse or disulfiram, which is used as a alcoholic prevention drug earlier. As per the basic issue, now this has disulfiram has major adverse effects and very serious adverse effects. The basic phenomena is disulfiram given prior to the consumption of the alcohol would produce very unpleasant feeling in the body, lots of physiological changes, and the patient may develop an aversion to the alcohol and he may stop. So disulfiram was considered as very standard, and success rate was claimed to be quite high, but now it is known that the success rate has become lower, but still it is one of the drug which is still used as such, and the adverse effects, complications produced with disulfiram are many, like fatigue, headache, impotency, metallic ulcer, taste in the mouth, eruptions on the body, polyneuritis, rash, hepatitis, neuropathy, optic neuritis, psychomotor disorders can occur. But still, the disulfiram use in the throughout is increasing, and global market of disulfiram is predicted to be increasing very rapidly, and India is one of the area where it is expected that the market would be enhancing rapidly by the market predictors. Now, anyway, that's chronic alcoholism, and de-addiction is one of the issue, and the de-addiction, I don't suggest any medicines. But there are certain people or certain another school of thought about the de-addiction is that instead of stopping alcohol all of a sudden, and some people say that the quantity of alcohol has to be gradually reduced and stopped. But that kind of an approach is absolute failure. Now, this data has shown that that kind of a replacement of alcohol with another sedative drug and stopping the alcohol would not have really much benefit. Most of the times, that reducing the quantity of the alcohol would not really help as such. And of course, there are certain people from Ayurvedic point of view where you may use Srikandasa or so on, which is considered to be an alternate to alcohol. I am not going to that part, but I don't suggest that kind of an approach to the treatment. Now, sudden withdrawal of the alcohol often either due to the maybe active involvement of the patient or otherwise can produce some symptoms, and the usual symptom of alcohol withdrawal symptoms are nausea, vomiting, sweating, agitation, anxiety, headache, tremors, seizures, visual and hallucinations may occur, but these are usually temporary. They do not last for many days. Maximum 1 to 2 weeks that these symptoms may occur. During this period, if we manage the patient with some mild sedative drugs, which I prefer as Smisagarasa, Kamadka, Sarasvarishta, and continue the counseling, many of the patients can be effectively maybe withdrawn from the alcohol and they can live life. But the most important is willpower of the patient. If the patient has a strong willpower and he is willing to stop the alcohol, then only alcohol can be stopped, consumption of alcohol can be stopped, otherwise not. Now, some of the patients during withdrawal may have severe delirium, like severe tachycardia, hypertension, body temperature may be enhanced, severe delirium may occur. In such conditions, simple Smisagarasa Kamadaka may not be enough. You may have to give diazepam like drugs. Now, another important issue from the point of view of alcoholism is from the legal point of view, identification of an alcoholic. Now, there is a lot of legal issue, persons who are involved with accidents or other criminal or cases as such. To confirm legal proof of alcoholism is one of the issues, and hence to make out that there are biomarkers which are used. Biomarkers are of two categories, indirect and direct, and these days there are a lot of new biomarkers are coming up from the point of view. The direct biomarker is the alcohol concentration in the plasma, blood or breathed air. But so in road accidents or maybe in the driving, erratic driving, police will have the breath test and then confirm whether the person is alcoholic or not. But the limitation of that biomarker is the concentration, direct alcohol biomarkers like the alcohol concentration in the air breathed in or maybe the blood would be that the duration of this would be positive only for a short duration, a few hours as such. Beyond that, the alcohol biomarkers may not be seen, blood alcohol levels may not be seen, but the consequences of the blood alcohol may continue to be there, or the crime might have been already occurred. And or another biomarker which can have bit longer effect is ethyl glucuronate seen in the blood. Ethyl glucuronate is a metabolic product of the alcohol which can be assessed in the blood. But because of this insufficiency of these direct biomarkers, the new biomarkers are coming up like acetaldehyde, fatty acid, esters, etc. And in future they may become a regular use as such. But they may not have, now these are mainly from the legal point of view, medical legal issues, than really the medical point of view. From medical point of view, indirect alcohol biomarkers could be useful, and they are mainly the enzymes of the liver, aspartate aminotransferase or alanine aminotransferase, SGPT and SGOT. These are the main enzymes which could be affected, and a altered enzyme level could be a confirmation of the alcohol biomarkers which says that there is a need for the treatment. And in such patients who are alcohol patients and their indirect biomarkers are enhanced, I would prefer to use Arogyavardhini and Kumari Asava along with the same withdrawal treatment as such. So that's about the general complications of the alcoholism as we use now. Coming back to Sushrita, the Pana Vibhrama is Hridgatrato, the Vamatu, Jvara Kantha Dhuma, Murcha, Kapha, Sravana, Murtharujo Vidaha, Dvesha Sura, Anna Vikritesho, Teshu Chatra, Pana Vibhrama Shanti Akshirana Dhiraha. These are the typical clinical symptoms of acute alcohol withdrawal, or what we call as a hangover effect as such. Acute alcohol withdrawal can produce the pain throughout the body, vomiting, fever-like feeling, and burning sensation over the body. Kapha sravana, discharges from the mouth, and headache, burning sensation also can occur, and the patient would have a dislike for the food. Hina uttara ostham adishitam amandadaham तैलप्रभा आस्यम इति पानहतं विजाख्यात जिह्वा ओष्ठदन्तमर्चितं तथा अथवा नीलं पीते च यस्य नयने रुधिरप्रभे च. A very chronic alcoholic condition, person who is addicted to the alcohol, he will have a thick lip. Visual, if you look at the face, the facial expression is very characteristic. The whole face may have a oily appearance, and the body may be bit colder. His teeth and lips may have a darker color or maybe a yellowish color, and that's considered as panahata. Acute alcoholism with over chronic alcoholism, and such a condition is considered as asadhya, incurable. Sushrita has considered bijakshyata. Hikka jara vamatu epatu parshashulaha kasabhrama vapicha panahatam bhajante. A patient with panahata may also have hiccup, fever, vomiting, and parshashula pain throughout the body also can occur. Tesham nibaranidanja mayochyamanam vyaktam abhidanam akhilena vidhim niboda. How to avoid this is the issue which is to be discussed in the next. Madhyanja chukra maricha ardaka deepya kushtha savarchala yutamalam pavanasya shanti prithvika deepyaka mahoshada hingu birva savarchalena vayutam visret sukaya. One of the options mentioned in Sushrita is prepare a specific madhya alcohol with the medications like chukra maricha ardaka for bataja or prithvika deepyaka etc. for the pittaja lakshanas. आम्रातक आम्रफल दाडिम मातुलुंगे कुर्यात् शुभान्यपि च षाडव पानकानि सेवेत वा फलरसोपहितान् रसादीन् आनूपवर्ग पिशरान्यपि गन्धवन्ति. Fruit juices of different fruits, or maybe the soups of flesh can be given according to the food habits of the patient. So most important is provide an alternative glucose source to the patient with the alcoholism. That's one of the options. पित्तात्मके मधुर वर्ग कषाय मिश्रम मध्यम हितम समुद्र शर्कर मिश्र गंधम. In pittaja condition, madhur varga siddha madhya. Now the important is in Sushruta's method, dealing with the alcoholism would be by giving a alternate medicated alcoholic preparation where you will be adding some specific medicines. It's not replacing one alcohol with another alcohol. It's a alcohol replaced with a medicated alcoholic beverage, where the alcohol is secondary, the medicines are the important facts, and that's how it has to be considered as such. Pītvā ca madhyamapi ca īśvara saprakāram nisheshita kshanam avasitam uldikhecha lava ena tittira rasamsha pibeda anamlan modgan sukaya sagatran sasilamsha yushanam. Another of the option again, īśvara saprakāra madhya, alcohol preparation with the sugar cane juice, and then vomiting, inducing the vomiting as such, and mamsarasas to be given. Panatye kaphakrite kaphamullikhecha madhyena bimbi vidula udaka sanyutena seveta tikta katukam sharasan udaran yusham tikta katukopahitani hitaya. Kaphaja madhya panatya, again the patient has to be given vamana, and the specific preparation with the bimbi vidula etc. has to be given. Pathyam yavanna vikritani chajangalani shleshmagdam anyadapi chetya niratyayam syat. Other food habits, food substances which also are prepared with the yava or jangala mamsarasa have to be given. Kuryat sarva matsa sarva bhave vidanam dundod bhave dvayam avayesha yathapadanam. Depending upon the dosha lakshanas, you may have the permutation combination of the same drugs as such. Samanyam anyadevi yaccha samagriyam agriyam vaksham yaccha manaso madakata sukham cha. To improve the status of the mind, the consciousness, some of the remedies which are mentioned which are useful are mentioned in the coming shlokas. So in the coming shlokas, the drugs which could be used in the acute alcoholism are mentioned. So I will be just casually reading that. Tvak naga pushpa magada ela madhuka dhanyaihi श्लक्ष्णैहि अजादि मरिचैश्च कृतं समांशैः पानं कपित्त रसवारि परुषकाढ्यं पानाप्येषु विधिवत् श्रुतम् अम्बरान्ते. One of the kashaya or liquid preparation. or ह्रीवेर पद्म परिपेलव संप्रयुक्तैः पुष्पैः विलिप्य करवीर जलोद्भवेश्च पिष्टैः सपद्मयुतैरपि सारिवाद्यैः सेकं जलैश्च विचिरैः अमलैः सुशीतैः. Sake or pouring the body with the cold water prepared with the drugs like ह्रीवेर etc. Then तक पत्र चोच मरीच एला भुजंग पुष्प श्लेष्माटक प्रसव वल्क गुडैः उपेतं द्राक्षायितं हृतमलं मदिरामयार्तैः तत्पानकं शुचि सुगंधि नरैः निषेव्यम्. Another of the panaka preparation. पिष्ट्वा पिबेच्च मधुकं कटुरोहिणीं च द्राक्षां च मूलम् असकृत त्रपुषी भवं यत् कार्पासिनी अथ नागबलां तुल्यां पीत्वा सुखी भवति साधु सुवर्चलां च. Another of the yoga which can be given. काश्मीरीय दारु बीटर दाडिम पिप्पलीषु द्राक्षान्वितासु कृतम् अम्बुनि पानकं यत् तद्बीज पूरक रसायुधम् आशुपीतं शान्तिं परां परमदे अचिरात् करोति. In the paramada, in the hangover conditions, one of the panaka which is suggested where you will use Kashmiri daru etc. द्राक्षासिता मधुक जीरक धान्य कृष्णासु एवं कृतं तीव्रतया च पिबेत् तथा तथैव सौवर्चलायुतं उदाररसं फलाम्लं भार्गीश्रुतेन च जलेन हित अवसेकः. Another avashek or pouring over the body, liquid to be poured over the body, prepared in draksha, sita etc. इक्ष्वाकु धामार्गव वृक्षकाणे काकाक्वयो उदुम्बरिकाष्ठ दुग्धे विपाच्य तस्यांजलिना बमेद्धि मद्यं पिबेच्च अन्ये गते तु अजीर्णे. Vamana done with these drugs, ikshak etc. And then after the vamana, once the patient has become the ajirna lakshanas are there, again the patient is given a small amount of alcohol. तक्पिप्पदे भुजग पुष्प विडैः उपेतं सेवेत हिंगु मरिचत एलयुतं मरिच एलायुतं फलाम्लं उष्णाम्बु सैन्दवयुतास्तु अथवा बिडपक चव्य एला हिंगु मगधा फलं मूलशुण्ठिः हृद्ये खडेर्य भोजनम् अत्र शस्त्रं. Food with prepared with these substances. द्राक्षा कपित्तफल दाडिमपानकं यत् तत्पानविभ्रमहरं मधुशर्कराढ्यम् आम्रातक कोलरसपानकमेव चापि खर्जूर वेत्रक करीर पडुषकेषु द्राक्षात्रिवत्सु च कृतं ससिलं हिमं वा श्रीपर्णिकायुक्तम् अथवा च पिबेतिमानि यश्चाह्वया उत्पल हिमाम्बु विमिश्रितानि क्षीरिप्रबाल बिस बीजीरक नागपुष्पपत्र येला वालुसित सारिव पद्मकानि आम्रातक भव्य करमर्दक कपित्थकोल वृक्षाम्ल वेत फल जीरक दाडिमानि. The drugs which could be used for preparation of the panaka in such patients. सेवेतवा मरीच जीरक नागपुष्प त्वक पत्र विश्व चविक येलयुतान् रसांश्च सूक्ष्माम्बरसुत हिमांश्च सुगन्धिगन्धान् पानोद्भवान् उदति सप्तगदान् अशेषान्. Specific diseases which could be produced due to Panatyaya can be managed with these drugs. पंचेन्द्रियार्थविषयाः मदपानयोगाः मृदुपानयोगाः हृत्याः सुखाश्च मनसः सततं निषेव्याः. पानात्येषु विकट ऊरुनितम्बवत्यः पीनोन्नतस्तनभर आनत मध्यदेशाः प्रौढाः स्त्रियो अभिनव यौवन पीनगात्र्यः सेव्याश्च पंचविषयातिशयस्वभावाः. A sexual activity or maybe seeing the body of opposite sex as such also is sexual voyeurism is considered as one of the remedies to come out of the alcoholic intoxication. पिबेद्रसं पुष्पफलोद्भवम् असिता मधुक त्रिसुगन्धिकयुक्तं संचूर्ण्य संयुज्य च नागपुष्पैः अजारिकृष्णमरिचैश्च तुल्यैः. Another of the yoga. वर्षाभू यश्चाह्व मधुक लाक्षात्पक कर्बुदार अंकुर जीरकाणि द्राक्षांच कृष्णमद केशरंच क्षीरे समालोट्य पिबेत् सुखेप्सुः. Another of the क्षीरपाक yoga. भवेच्च मद्येन तु येन पातितः प्रकामपीतेन सुरासवादिना तदेव तस्मै विजुवत्प्रलापेत विपर्यये भ्रंशम् अवश्यं ऋच्छति. That's the basic principle is a person who has having an acute intoxication, the patient has to be given small amount of medicated alcohol so that the patient would recover. Of course, a questionable issue issue of debatable issue, so we will leave it as such. यथा नरेन्द्र उपपदस्य कस्यचित् भवेत् प्रसादः तत एव च नान्यतः ध्रुवं तथा मध्यहतस्य देहिनो भवेत् प्रसादः तत एव नान्यतः. Like the simile given for this by Sushruta is if Indra Vajrayudha has hurt anyone, he can recover only because of the Indra Vajrayudha, nothing else. And similarly, alcoholic patient can recover only with the alcohol. विच्छिन्न मद्यः सहसा यो अतिमद्यं निषेवते तस्य पानाप्त्ययोद्दिष्टाः विकाराः सम्भवन्ति मद्यस्य आग्नेयवायव्यो गुणौ अम्बुवः च श्रोतांसि शोषयेतां तेन तृष्णा उपजायते. If a person has withdrawn from the alcohol and then again consumes alcohol again, then the patient may have a high tendency to have the diseases. And because of the Agni Guna and Vayu Guna of the alcohol, the all the sources of the body will be drying up. Patala Utpala Kandeshu Muddhavarnyanti Sadhitam Pibet Magatikon Mishram Tatra Ampho Himashitalam. In such conditions, when the patient has excess of thirst and dryness of the channels of the body, the Kashaya prepared with Patala Utpala have to be given. Or the other Kvata Sarpihi Taila Vasa Maja Dadi Bringar Seritam Kwaten Bilva Evayoho Sarvakandesha Peshili Pakvam Abhyanjanesham and Abhyanga with the drugs like Sarpis Taila or Sheka Kwatha Rasavantija Bhojani Yathaswam Avjaret Panakani Sushitani Hridyani Surabhinija. Nourishing food according to the condition, and cold panaka which is supporting to the general condition of the patient has to be given. Tvacham praptastu panoshma pitta raktabhimurchitaha daham prakrute ghoram pittavat tatra bheshajam. Alcoholic consumption would increase the body temperature because of the involvement of the pitta rakta in the subcutaneous area, and in such conditions all the pitta kriya has to be used, and they make the person body cool. The Shita Vidhana, Shitam Vidhanam Ata Gurthumaham Pravakshe, Daha Prashanti Karam Ruddhimatam Dharanam, Tatra Agito, Malayajana Hita Pradeha, application of Gandha over the body. Chandram Shahari Hara Tuhinodaka Shitalena, Shitam Shitala Taesha Shayanamenam, Harehi Mranalahi Abalahas Prishehu, Bina Utpala Ujvala Hime Shayane Shayita. He should be kept in a very cold environment, and the cold environment is prepared with all these plant products and water, and the people in the opposite sex would be in his company. Asadayan Pabanam Ahtamganabhi Kasara Padmadala Shaivala Sancheshu Kanti Vanantaponi Paramishamana Shaktaschare Bhavana Kanan Dirkika. So he should be in a well ventilated garden surrounded by the different flowers and leaves and the persons of opposite sex. A pleasant environment. Daha Bhutam Athava Parishachetu Lamajaka Amburuha Chandana Toyatoehi Visavitam Hatamalam Nabavaipurnam Padmotpala Kulajalam Adhivasitambum Vapim Bhajeta Hari Chandana Bhushitangaha Kantakaras Prashana Karkasha Romakupaha. He may take a bath in a well or this water source if there is a lot of burning sensation surrounded by people of opposite sex. Tatra enam amburuha patra samehi sprishantyaha shite karor udanehi kathinehi stanescha toya avagaha kushalas madhura swabhaha samsharshayehu abalaha sukalehi pralapehi. He should be stimulated by the people of opposite sex by touching with the different or maybe the sensitive parts of the body, sexually sensitive parts of the body. Daragrihe pragalita udaka durdinabhe klantah shayita salila anila shita kuksho gandhodakaihi sakusumehi upasikta bhumo patrambu chandana rasehi upalikta kudye jati utpala priyaka प्रिय केशर पुंडरीक पुन्नाग नाग करवीर कृतोपचारे तस्मिन् गृहे कमल रेणुवर्णे शयित यथाहृत अनिल विकम्पित पुष्पदाम्नि. Another very decorated room is to be prepared where he has to be nursed. हेमंत बिंद्य हिमवत् मलयाचलानां शीतांबसां सकदली हरित दुमाणां उद्भिन्न नील नलिन अम्बुरुहकारान् चंद्रोदयस्य च कथाः शृणुयान् मनोज्ञाः म्लानं प्रतान्त मनसो अनुकूलाः पीनस्पन ऊर्जगनाः हरिचन्दनाङ्ग्यः तायेनम् आर्द्रवसनाः सह संविषेयुः श्लिष्ट अबलाः शिथिल मेखलहारयष्ट्यः. He should be made to hear some stories about, or maybe the anecdotes about the cold environment of the maybe hills, and he should be surrounded by women of such sexually stimulating environment. हर्षयेयुः नरं नार्यः स्वगुणैः रसस्थिताः ता शैत्यात् शमयेयुश्च पित्तपानात्ययान्तरम्. The sexual activity is one of the remedies for the Panatyaya. त्रिणुदाः रक्तपित्तेषु कार्योऽयं भेषजक्रमः साम्यन्त विशेषं शृणुदाहेषु अशेषतः. कृष्णदेहानुगं रक्तम् उद्रिक्तं लहरीह्यते सञ्चुष्यते लक्ष्यते च ताम्राभस्ताम्रलोचनः लोहगन्ध अङ्गवदनः वह्निना अवक्रियते तं विलङ्घ्य विधानेन संसृष्ट आहारम् आचरेत्. अप्रशाम्यति दाहे च रसैः तृप्तस्य जाङ्गलैः शाखाश्रयः यथा न्यायं रोहिणीः व्यधयत् शिराः. In severe daha, where the patient would have a rakta prakopa, rakta mokshana is suggested. Rakta mokshana with all the preparations where the patient has to be given or the patient who has a extreme reddishness throughout the body, acute burning sensation, rakta mokshana is suggested. Pitta jvara samaha samitta apyasya vidhirita. All the pitta jvara treatment has to be done. तृष्णा निरोधाद अब्धातौ क्षीणे तेजस् उद्धतं सबाह्याभ्यन्तरं देहं दहेद्वै मन्दचेतसः संशुष्क गलतालुस्तोहितं जिह्वां निष्कृष्य चेष्टते. Due to the suppression of the thirst as such, and aggravation of the Ushna Guna in the body, there would be burning sensation and a dryness of the mouth, and because of the dryness of the mouth, the patient would be protruding the tongue and then lie down. In such conditions, tatra upashameyet tejastvabdhatum च विवर्धेत पायेत कामं भश्च शर्कराढ्यं पयोपिव शीतं वीक्षुरसम्मर्दं वितरेच्च ईरितं विधिं. You have to give liquids which are nourishing. असृजा पूर्णकोष्ठस्य दाहो भवति दुस्सह विधि सद्यो व्रणयोक्तः तस्य लक्षणमेव च. In patients with the severe alcoholism may have bleeding into the gastrointestinal tract. Bleeding into the gastrointestinal tract is one of the complications, and such a condition would be treated as per the Sadhya Vranokta Chikitsa. And the treatment protocol would be Dhatukshayokta Yodaha Stena Murchatachanidha Kshamaswara Kriyahina Vrisham Sidati Piditaha Raktapitta Vidistasya Hitaha Snigdho Anilapaha. All the Dhatukshayokta Vidhi and Raktapitta Vidhi has to be followed in such patients and who are having a poor general condition. क्षतयेन अश्नतश्चान्यः शोचतो वापि अनेकधा तेन अंतर्दश्यते अत्यन्तं तृष्णा मूर्छप्रलापवान्नं तम इष्ट विषयोपेतं सुहृद्भिः अभिसमृतं क्षीरमांसरसाहारं विधिनोक्तेन साधयेत्. A patient may become depressed due to alcohol. Alcoholic behavior should be in total depression, and such a patient who is absolutely depressed along with the physical signs of burning sensation and thirst etc., he has to be even a social counseling, a group of people who are friendly with him, they have to surround him, and then he has to get involved in the social activity. Marma vikata jo abhi asti asadhya tamasmrah. A person with alcoholism may even have a impaired vital function, and such condition is considered as a fatal. A severe coma with the respiratory failure can be fatal. सर्व एव वर्ज्याः स्युः शीतगात्रेषु देहेषु एवं विधेषु पवेद्यस्य मदिरामय पीडितः. If the patient's body has become cold after consumption of the alcohol, that's also considered as a poor prognosis and the patient would not survive. प्रशांत उपद्रवे वापि शोधनं च प्राप्तमाचरेत्. Once all that acute complications are handled, then shodhana has to be done. सजीरकाणि आर्द्रक शृंगवेर सौवर्चलानि अर्ध जलप्लुतानि मद्यानि हृदयानि अथवा गन्धवन्ति पीतानि मध्ये शमयन्ति तृष्णां जलप्लुतश्चन्दन भूषिताङ्गाः सग्वी सभक्तां विशितोपदंशां पिबन् सुरां नैव लभेत रोगान् मनोनुविघ्नं च मदं न याति. Non-intoxicating alcoholic beverages can be prepared with the jeeraka etc., and they can be given in such patients. And one of the important issue which we need to be aware is, which is a concern of the present day, is there are a lot of publicity about Ayurvedic drugs being sold as an alternative to alcohol and inducing the alcoholic beverages, and we people have to be sensitive about this, and maybe somehow this kind of a publicity has to be avoided. With this, let me conclude. इति सुश्रुतसंहितायाम् उत्तरग्रन्थान्तर्गते काचिकित्सातन्त्रे मलाट्यप्रतिषेधो नाम नवमोऽध्यायः आदितः सप्तचत्वारिंशत्तमोऽध्यायः. If there are any questions, we'll try to answer. And then there is one question. Recently, in the consumption of asavarishta are also being, that's exactly the point which I mentioned, like there are a lot of negative publicity, and that negative publicity has to be taken care of. We have to avoid this. Maybe our policy makers have to take some step. As practitioners, we may not be able to do much there, but let us not get involved in such activities. That's all the point which we can make out, right? Right, with this, no other questions.